pandemic or epidemic or outbreak in future on the lives of Nigerians. And so we're pushing for a situation where we can have a resilient, strong system, a strong public health response system. We're happy that it's beginning to happen. Before now, we never used to have functional EOCs, public health emergency operation centers in different states. Probably the state epidemiologists would just be in one small office somewhere and nobody ever knew who they were. Surveillance officers were not known. There were no rapid response team. But these are public health response systems that are beginning to spring up everywhere across the nation, which gives us some form of comfort. But what we want to see is more of the federal government supports to states to be able to build resilient health systems at the state level. Remember, it's a combination or accumulation of all of the states' health system that forms the national health system, whether it's strong, whether it's functional, whether it's not. We also want to see a system where we can have universal health coverage fully instituted in Nigeria. And we can have the health insurance scheme, which is part of one of the ways to achieve universal health coverage, working in Nigeria. Several states have not started the implementation of the state health insurance scheme across board. And of course, some of the funding is supposed to come from the Basic Healthcare Provision Fund. As I speak to you, NHIS has not released a dime from the Basic Healthcare Provision Fund has not been released to any state to help them to be able to build their state health insurance scheme, enroll people, work facilities up on the supply end, and then of course begin to deliver services. We are happy that last week at the National Council on Health, we were able to push an agenda for the immediate implementation of the Basic Healthcare Provision Fund, which has been stalled for over a year right now. I think the president launched it in January last year, and up until now, we're still having issues, but we're glad that was resolved, and implementation is going to start almost immediately. We believe that this funding is going to states will further strengthen the system from the primary to the secondary, and of course, to the tertiary form of healthcare in our various systems. So we want to see Nigeria leverage this COVID-19 pandemic to fix the health system and make it more resilient. We want to see a situation where the Basic Healthcare Provision Fund can begin to work almost immediately, and then other fundings, both external and local fundings, can be mobilized to improve on health services in the states. Remember, at this point of COVID-19, there was lockdown in lots of states. IGR went under the ground. Most states might be unable to pay salaries at the end of this month. A lot of other issues are going on. So at this point, the federal government really needs to come in and help states, help the health systems across states. This will help a whole lot to deliver services to our people.